Urea cycle disorder presenting as bilateral mesial temporal sclerosis, an unusual cause of seizures, a case report and review of the literature. By Furene, Sijia, Wang, Denise, Meng and Hian Tadong via Journal of Medical Case Reports, latest articles. Abstract. Background. Urea cycle disorders are secondary to defects in the system converting ammonia into urea, causing accumulation of ammonia and other byproducts which are neurotoxic. Ornithine transcarbamylase deficiency is the most common of the urea cycle disorders and frequently presents with coma or seizures during hyperammonemia. However, seizures can also occur without metabolic decompensation. Case presentation. We describe a 23-year-old Chinese woman with urea cycle disorder who presented with confusion due to focal seizures arising from the left frontotemporal region. Interestingly, her ammonia levels remain normal during the seizures. Neuroimaging showed bilateral mesial temporal sclerosis. Her seizures were successfully controlled with 2 antiepileptic medications. Conclusions. This case adds evidence of the predisposition of the temporal lobe to injury in urea cycle disorder. Urea cycle disorder can lead to mesial temporal sclerosis, which leads to increased susceptibility of patients to seizures regardless of their metabolic state. Keywords. Urea cycle disorder, mesial temporal sclerosis, hyperammonemia, magnetic resonance imaging. Background. Urea cycle disorders, UCD, are a group of inborn errors of metabolism caused by the dysfunction of any of the 6 enzymes or 2 transport proteins involved in urea biosynthesis. The 6 enzymes are carbamyl phosphate synthetase I, N-acetyl glutamate synthetase, Ornithine transcarbamylase, arginine-succinic acid synthetase, arginine-succinate lyase, and arginase. The 2 amino acid transport defects are ornithine translocase and aspartate, glutamate carrier. All of the UCDs are inherited as autosomal recessive disorders, except for ornithine transcarbamylase, OTC, deficiency. A defect in urea synthesis results in hyperammonemia, which disrupts the aquaporin system and increases astrocyte glutamine synthesis, causing brain edema and raised intracranial pressure. 1. The severity of the UCD is influenced by the position of the defective protein in the pathway and the severity of the defect. The clinical presentation is variable, with the most severe forms presenting in the neonatal period with seizures, coma, and multi-organ failure. The seizures can be subclinical during acute hyperammonemic episodes. Milder forms of UCD can present at any age with metabolic decompensation or more subtle symptoms such as developmental delay, and behavioral or psychiatric symptoms. However, with good metabolic control of the underlying disease, resultant epilepsy is rare in the course of the disorder. Add tags. Currently, cases, medicine by Alexandros G. Sfakianakis,